So good afternoon, everyone. Thank you for participating in our second Community Task Force meeting. We're going to get started. Melissa has opened and asked that you sign in, if you will, in our chat room, listing your name and your organization. We're going to have Mr. Parker kick us off. We will share our most recent update with you all since our district made our announcement about our virtual opening. Once we move through that PowerPoint, we will allow some time for you as our partners and a critical stakeholder group to ask any questions, give us any ideas for considerations and recommendations as we move closer to reopening or launching, if you will, our virtual campus. So, Mr. Parker? I have to let people in the waiting room. I think I have to.
Oh, can you hear me now?
Mm-hmm.
All right, so thank you, Dr. Brown. Good afternoon, everyone. I wanted to, again, thank you for taking time out of your schedule to engage and support as we begin this journey, or continue this journey, rather, of ensuring that all of our students have a high-quality learning environment. And I won't go over all the details of things that I shared before, but know that our intention at this point is to open for at least the first 9 weeks, the first quarter, in a virtual environment. And that decision was not one that was made lightly. It is not one that was made without understanding or being sensitive to the needs of our families that have to manage childcare. We understand that that's absolutely going to be a challenge and a concern that we're going to partner with you all and partner with our families to address. However, the reality is that there are just too many unknowns right now about the virus that places our children and our adults in harm's way. And if we have the ability to provide a high quality learning environment in a virtual format, I think we now have the moral imperative to go that route, because that's going to be the safest environment for our students. Incidentally, when Allentown School District announced, we were the first district in the Commonwealth to officially announce that we were going that way, although we kind of have an idea that there were some other districts that were considering. But I think from a social, political pressure standpoint, Pennsylvania has been leaning more towards the hybrid opening. Since we have made that announcement, my understanding is that Philadelphia made that announcement on yesterday that they're going to be going to the virtual learning environment. And I expect that over the next week or so, the largest 5, 6, 7 districts in the Commonwealth are going to follow suit with a similar announcement. I've talked to a few of them that I know are going to announce within the next couple of days. A lot of them were kind of just waiting to see who was going to be the first domino to fall. And it's always great to be the leader in something in Allentown. As well, a number of the districts locally have identified their plans that create hybrid openings, but also give them flexibility to go into a virtual opening at a moment's notice. And I think a number of them may go that route as well. I would love to be able to say that we can provide a safe environment for all students in our buildings right now. The reality is this district and any other district can't really make that full guarantee right now. So we're making I think, most wise and best decision to give ourselves and our community time to see how the virus will continue to affect us, and then make a different decision in 9 weeks in terms of returning to classrooms. So with that, I'm going to turn back over to Dr. Brown. I'll be in there in a minute, but I appreciate you all again and look forward to your feedback and some of your critical thoughts or questions as it relates to how this potentially I'm willing to listen to everybody except Owen. We're not talking to Owen because we don't hear anything about transportation. That is the bane of my existence right now. But everybody else is welcome to join in and give us their thoughts and questions. With that, Dr. Brown, the floor is yours.
So, Mr. Parker, as we move through this presentation, the early slides were some of the ones that you wanted to speak to. Would you like to, I'm kind of guess handing it back to you to introduce our discussion.
Sure. You gonna give me more time to talk?
Yeah,
Is that?
That's
There you
always positive.
Yeah, I think it's up now.
can you see the screen?
Yes, have her put it in presentation view though, so that everybody can see it fully.
There we go. Is that good? The only downside is I can't get to the chat box from here.
Well, then she's.
Or I can-
This one wasn't.
Yeah.
Okay. All right.
Go there.
Yeah, so just in terms of intro, without going into too much detail, we grounded our decision and our process, as I said a few moments ago, really connected to our core values as an organization that are spelled out in our strategic framework. And for those of you who may not have a copy or don't quite remember in detail, those 5 C's, those first 3 C's, we're creating a culture where students feel safe, valued, and nurtured. We're centering our work on personalized learning and instruction, and we're collaborating meaningfully and deeply with our families and communities. And everything about this process up to this point has been rooted in those 3 core values. We need to make sure students feel safe, valued, and nurtured. In being in a classroom or at home, it's still a requirement for us to make sure they feel safe, valued, and nurtured. Personalized learning and instruction, we've been moving the direction of one-to-one and personalized learning well before the pandemic. This allows us to accelerate that approach. And then lastly, much like the conversation today, having a series of these conversations with community members, families, students, et cetera, ensuring that we collaborate and we don't just share, but we also listen and process for what we hear. So our core values are well documented and on display as we take this this approach into the future.
Great.
Noted.
Okay, great. So here we have just a running list of our ASD pandemic planning team. We brought this information to you before, but didn't specifically call out all of those departments that are involved in this work. And so we wanted to make sure that as we push out information to our critical stakeholder groups, it's very clear and evident that this is a inclusive, multidimensional planning team, and we have ensured that every relevant department is included. We shared this information with you prior. These are our district informational sources that are driving this information. First and foremost, the original CDC guidelines, our PDE, IU, and any other regional planning task forces. We have our district level working group. We have a principal or several principal and building level working groups, you all as our community partners, and then our families and staff. We also wanted to highlight those stakeholder groups that may be a little bit more nuanced than our informational sources. So our administrators, our teachers, last we spoke, we were planning to host 250 teachers in a series of 3 focus groups, which we were able to do successfully. And from those 3 focus groups, we narrowed the 250 teachers down to approximately 20 teachers that are serving as a working group for us to tease through critical elements and topics such as a student schedule, what an instructional day would look like for teachers at the elementary, middle, and high school levels, and really just using our teachers working group to operationalize a number of the work that's coming forward from our district planning team. We followed that same process with our parents. So we issued an all call for any parents to provide some input and feedback, not just through our surveys, but again, as a focus group and then a smaller working group. And so we have a group of approximately 21 parents that we are convening to do the same thing that we have our teacher working group doing. Our collective bargaining groups, we're including them in their separate conversations and allowing for space and opportunity for them to do the same thing that we're allowing our community partners to do. Give us recommendations, share any concerns and considerations, and really bring these critical stakeholder groups along as we move through this time of uncertainty, and we're needing to pivot and be professionally agile, if you will, as we roll out our virtual campus. Here's another data point that we've updated, and we shared the original data point on the left that's dated June 29th with you all, where we asked our families through our survey if they felt comfortable sending their student to school. And so we wanted to update this data because this updated data that was culled on July 23rd actually supported the decision-making process to move forward with virtual. So we continue to monitor the data trends as we told you we would through the month of July. And as we came upon the decision-making point, we saw a shift in our data where more families who originally said that they were comfortable sending their students to school had actually changed their minds and considered that they weren't comfortable. So we wanted to share that just to show that swing, if you will. In terms of our staff, and if any of you were on for our July board meeting, several members from our AEA group, our teacher union group spoke, and again, they confirmed and reiterated that they're absolutely willing and ready to return to buildings. However, their foremost concern is health and safety. And so we just wanted to acknowledge that and begin to counter the narrative or support our teachers as they communicate out and demonstrate that they're willing to go to school, but there are some priority needs in terms of health and safety that are prominent in that group as well. And coincidentally, that was a top response for our families as well. So in terms of that district outreach, a data point where our staff and our families were united was in the concern for health and safety protocols within the district. And again, although it could be a pain point, it was something that we needed to own, and we needed to make sure that we faced from a point of reality in terms of some of the public health indicators that have impacted our decision to launch our virtual campus as well. All of that information was processed through 4 primary sources or methods, if you will. We continue to conduct our internal and external meetings throughout the month of July. We continued our internal communication updates. As I spoke to in a previous slide, we continued those large focus groups and broke those focus groups down into smaller working groups. Again, so that we could have both buy-in and consensus as we move forward with some difficult or challenging decisions. Within that processing of information, we were able to develop a number of district protocols, procedures, and guidance that will support us in communicating with all of our stakeholder groups, internally and externally. And so what is in the pipeline for dissemination once we've vetted it properly through our planning team and our building level working groups and some of those other stakeholder groups that we mentioned are a number of guidance documents that are listed here. So health and hygiene protocols. How will we clean and sanitize our buildings and our classrooms? And again, this is important that we're transparent in these areas so that we can begin and continue to build community trust in the district. As you saw, the primary concern was that health and hygiene protocols would not be adhered to. So we're going to continue to develop these protocols and be transparent and communicate those out to get buy-in, build consensus, and build trust among our stakeholder groups. Our virtual and hybrid instructional model. So yes, we're opening our schools with a launch of our virtual campus. But as we begin to move and reopen and bring our students and faculty back into our buildings in the future, what do those hybrid instructional models look like? And we're beginning to build them in anticipation. So we're not waiting for a date to drop and have to scramble to get this work done. We want to be proactive, and we want to, again, promote buy-in and build consensus as we build these instructional models. Our building and classroom readiness criteria, again, taking those district-developed health and hygiene protocols and operationalizing them at the building and classroom level. So what does it mean for a classroom to be disinfected? How do we share that information with our families and our staff so that they feel confident that it's safe to re-enter our buildings and resume their workflows and their job responsibilities as the district needs them to do? What staff training do we need on health and safety protocols? What roles need to be expanded a bit so that they can support that work? Because as we ramp up disinfecting and sanitization schedules, we know that we have limited custodial staff. So how do we build that into daily routines and workflows for other roles? Student scheduling, what does that look like in the virtual realm? But again, how do we develop our schedule so that when we begin to bring our staff and students back into our classrooms, how do we do that seamlessly and with the least amount of interruption in their instructional day? Effective use of technology, making sure that technology is available and accessible for our students and staff virtually, and as we move toward bringing folks back into the building. And I'm looking to my left to see if you wanted to chime in on Wi-Fi or devices here and some of the discussions, and you look very excited, so I'm gonna.
So I was booted out of the system for a bit, so I missed some of the beginning of the conversation, but I was transitioning in.
Sure, just giving our community folks and sharing discussion points that we've had on developing district procedures, protocols, processes on these areas.
So in order for us to again, to that first area where we're collaborating deeply and we're ensuring that we have a personalized learning environment, we are going to ensure that we provide every student that needs a device with the device. We purchased 8,000 plus devices earlier this year, so we'll be able to cover students that need devices with devices in addition to the devices that we already had in district. Students that had them earlier this year, we did not retrieve those devices save for seniors, so we'll be able to reallocate the ones that seniors had, and students that were already enrolled in the district, already picked up a device, will keep them. I think I'll give some hop and kudos out to the United Way, who worked with Dr. Brown and the team on developing some protocols to allow us to ship devices to homes and things of that nature. So we're going to go through the process with our registration of re-identifying every student that needs a device. As well, we know that, similar to a textbook in a regular learning environment, Wi-Fi now becomes a requirement for students to progress through their curriculum as mandated by the state, which means school districts will now own the responsibility to ensure that students have access to high quality Wi-Fi. It's no longer an option. It's no longer a great thing if they have it. It now becomes as critical as ensuring that a kid has a pencil. So the district will own the responsibility and hopefully collaborate meaningfully and deeply with our community to ensure that all students have access to Wi-Fi. For me, those are non-negotiables and things that we are identifying internal resources to support, asking and pushing for external grant opportunities to support. We've had those conversations internally and with external stakeholders regarding the digital divide and how we can identify ways to address in our communities that need it the most to provide, and I'll come back to use the term again and again, barrier-free access to all. If there's any barrier to Wi-Fi for a kid, whether that's a barrier from a parent that has, legal issues, credit issues, kids that move house to house, whatever those barriers are, we are duty bound to eliminate those barriers so that students have barrier-free access to Wi-Fi, because there cannot be any excuse why a kid wasn't able to access the curriculum in the way that it has been identified. So that will be over the next month and a half, a number one critical point of emphasis for the district. I know that we already have some partners on the call that have committed and are engaged in that conversation on a consistent basis. So thank you. And for those that haven't, I know that you will be kind of joining us in that conversation into the future. We've already heard some feedback from community organizations regarding, if we're managing kids in support of parents during the hours that they would normally be in school, how can we identify device and access for those kids? And that's something that we're processing internally. Again, every kid, we'll make sure every kid has a device, so there should never be an issue where a kid needs or doesn't have a device. We'll be able to provide that as much as possible, because we do have some community members that have partnered with us to provide devices for kids. So we're not going to say that we bought everything, because there are community members that absolutely committed and supported there. And we're going to make sure that we can provide barrier-free access to all students who need it. So lots of conversation, resources, and I think collaboration necessary in those critical areas.
Right. So thank you. That takes care of our effective use of technology and our resource allocation. We're also working through meal distribution, what it looks like during this virtual period, but also ongoing through our hybrid and reentry processes. And then lastly, the continued acquisition of PPE. As many of us are aware, there's been breaks in the supply chain for hand sanitizer, masks. I believe that we have a link that we're going to share in the chat room to give you an idea of the PPE that we have been able to acquire, and we're making sure that we're able to provide to our staff, particularly our teachers, masks, face shields, our students, masks, classroom sanitizer, anything that we will need to ensure that upon reentry, both our staff and students are able to feel like they're in a safe environment where we're absolutely being intentional about outfitting every classroom and every building with the proper PPE.
PPE. I'm gonna drop it in the chat.
Are you?
They're seeing your screen here.
Why isn't it advancing?
Again. Now mine's frozen. Oh, that works.
Okay. So next, PDE identified conditions for reopening of schools. And we thought it relevant to share this conversation, not just with our community during our public board meeting, but also with you all as a group of critical stakeholders. There are 5 indicators that PDE identified for school districts to monitor. And during our public board meeting, we did have Vicki Chrysler on the line. She's unable to make it today, so I would never be able to do justice to her presentation or discussion of these 5 areas. So suffice it to say that you can read these indicators. There's a link there, and I believe we're sharing the PowerPoint with you all, where PDE has connected to a dashboard that will allow for the monitoring of those 5 indicators. So those 5 indicators are driving our conversations. We've included weekly meetings with our healthcare partners. That includes the Department of Health, Lehigh Valley Health Network, and St. Luke's, where each week they're sitting down with our HR department and our student services department and really going over sort of the status of not only community spread, but also vetting a number of those guidance documents and protocols that we're sharing out with our internal staff and external stakeholders to support bringing everyone along as we adapt and adjust to this COVID reality that we're facing. PDE developed a phased reopening school plan that, again, is based on local public health indicators, and that plan follows really red, yellow, green process. Here before you, you have some of the key elements or definitions of how PDE has defined how schools should reopen based on the status that the state is in. And as you are aware, our state is currently in the green stage. However, based on those 5 indicators that were on the previous slide, that's how we're to be making our decision. And all that to say, our positivity rate for testing has increased. It's above the CDC identified 5% that the CDC identified as an indicator. So saying that schools should be cautious in opening when the positivity testing rate is above a 5%. Last I checked, we were at a 6.5%. I'm not sure what it is today, but again, we're building in the opportunity for us to monitor that as a district through those 2 departments that I mentioned previously. Presently, based on Governor Wolf's most recent recommendations or guidelines, where we're not directly in the yellow phase, but as Mr. Parker likes to say, we've moved to, we're still green, but he calls it a watered down yellow phase. The Allentown School District, we're at the point where we have essential workers only coming in. We have instituted a teleworking process so that all of our staff, even at this point in time, are not coming into the building, but working remotely so that we can ensure safety. And in terms of our instructional piece, as we said, all of this supported the decision to move forward with the virtual campus. We continue to have our pandemic team monitor the public health indicators, and that will be ongoing until a time is we're not supposed to do that anymore. So we'll continue to do that. But this is just to give you an idea of that phase reopening plan and guidance that PDE has set forth for LEAs. During our public conversation, we did share some discussion about the public health indicators. There's the link there. And again, you all have the PowerPoint, so you're free to go to that page. But for the sake of time, we'll move forward with our presentation. Here's a repeat of a slide that was shared with you before. Our virtual campus is really built on these 5 pillars. And I'm not sure if Mr. Parker is logged in, but he wanted to highlight the reintroduction, if you will, of our Family and Community Engagement Center. As we roll out a lot of this information, we want to be really strategic and intentional with our families. And so our Family and Community Engagement Center will take the leading role, if you will, in supporting that work. And we will be building in a number of places within our planning process where we can elevate that office and thereby elevate our communication and engagement with our families. High quality instruction is still the utmost priority. In fact, our academic team just concluded a meeting with our partner on this work at Elements, where they're really working hard building out instructional models and operationalizing what the roles will look like, from teachers to paraprofessionals to facilitators, what this will look like in our virtual campus. The expectation is that every single instructional role be working during our launch of our virtual campus. There will not be the plan or the practices that we set forth during our long-term closure period. Please know that that was a stopgap plan. That was an emergency plan set forth by PDE to get us through the end of the year. This virtual campus is not that. This virtual campus is being built and launched, again, with these 5 pillars of family and community engagement, high quality instruction, a acute emphasis on health and safety protocols, and obviously flexibility for our students so that they're able to engage and be as successful as we can support them in being during this time of uncertainty. Our ASD virtual campus is predicated on not only those pillars that we just discussed, but also on our students and our staff's accessibility to Wi-Fi access. So Mr. Parker spoke a lot about approaching or addressing the digital divide and working with partners. And again, our strategic framework is listed because no one knew that we'd be facing,
Parker.
no one knew that we would be facing a virtual, no one knew that we'd be facing a global pandemic. However, at the time of the launch of our strategic framework, we did identify addressing the digital divide and using external partners to support in that work. And Mr. Parker spoke to that already. Our Chromebooks, same thing. That is a key element or component for student success in our virtual campus. And so we are making sure that those families that do not have a Chromebook have an opportunity to still communicate to us their need. And we absolutely will work to get devices out to them. Our virtual registration, as a result, reopened on Monday, July 27th. I don't know if we have a link to that, but if you can share that out with the families that you all service, or just have it as a resource as you're supporting our families in your own regard, that would be helpful. That registration is feeding information directly to us about access to Wi-Fi and devices, and we're confirming registration with our families through a mailing postcard that they'll receive that will confirm their registration and then allow them an opportunity to continue the enrollment process through the website link being provided to them. Again, as we launch this virtual campus, we want to make sure that we are intentionally developing orientation and support for all. So not just our staff, but our families as well. And this is a brief schematic on that orientation and support. So you heard me mention instructional design models. We're working to make sure that we have those developed and we have our staff well trained on those instructional design models, but that we also build out a family and community engagement piece so that our families are equipped to support their students as we embark on this virtual learning experience. We're building our principal capacity. We started our principal professional development this week, and I believe the last report that I received this morning, we've had about 131 principals and other AEA members, I believe reading specialists, that if they did not participate in professional development between Monday and today, they are scheduled to complete some professional development this week. So by the end of this week, we will have approximately 131 principals and other instructional leaders completing first series, if you will, of professional development to support the virtual campus. Our teacher capacity, we're building out in the same way. We're getting ready to launch our teacher professional development offerings, and we will roll these professional development offerings out. We will have post-training surveys, but we're also recording and creating a library of sorts, if you will, so that teachers and principals and other instructional staff that are not available to participate in our professional development opportunities have access to them outside of the scheduled times so that they are able to drive their own professional development if they were not available. So we really want to go back to that core pillar of flexibility and making sure that that is a feature of our professional development for our staff as we move forward. Lastly, family orientation and support. We are building out a virtual campus parent university for all of our families, regardless if their students are in regular ed, special ed, or English learner students. And we just met this morning to go through a robust communication plan. But again, we're working with our educational elements partners. We're working with internal teacher working groups and principal working groups to build out what that will be so that we can ensure that we're absolutely escorting our families into this virtual environment and making sure that every need that they have with supporting their students is met by us as best that we can. Lastly, we always end with the next steps piece. So I wanted to share here where we are, where we're going for the next 4 weeks. We will launch our virtual campus communication plan. And at the time that we presented this to our community last week, we launched it with the document that's shared as a visual for you on the right-hand side of the screen. And I believe we have a link to that document that we're sharing with you now. It's basically an introductory informational page to our virtual campus. We're calling it our quick fact reference sheet. It is just used to begin to shape thoughts and share information on our virtual campus. There are more communication documents that will be shared out. We're building out our website page. The link to the web page will be shared with you. It is under construction at this time. However, there is a copy of the press release that lives there right now. Feel free to peruse around and see where we're going. But again, it's just to get the ball started and ball rolling with where we're going with launching our virtual campus. We'll continue to monitor our family survey. As of today's date, there's approximately 2,900 responses to that survey. And again, we monitor that survey for changes in trends, as we shared with you earlier with the whole notion of families being comfortable with sending their students back to school. We were able to identify that through the continuous monitoring. So we'll continue to monitor that survey. We're going to continue our meetings and focus groups and working groups. I know that our elementary virtual campus working group, which is chaired by Kate Griffin, who's on our call today, they met today. Our middle school virtual campus working group is chaired by Frank Garrett. He's working diligently with middle school principals to operationalize all of this high-level discussion that I'm having with you and make sure that it makes sense at the middle school level. And similarly, Jose Rosado Jr. is chairing for our high school principals and doing the very same thing with this work at the high school level. Yes, we reopened our virtual learning registration. I mentioned that. We're finalizing our building level reopening plan. So we have a district plan that we're submitting to PDE, but we're also having our principals move through a building level plan for internal use only, so that it helps to guide and standardize some of the behaviors that we need to have in place to ensure an emphasis on health and safety protocols going forward. We will conduct our building readiness visits, and we're using those virtual campus working groups at the elementary, middle, and high school level to help us build and develop a meaningful building readiness process and procedure. We're going to continue our professional development opportunities. As I mentioned, we started with our Act 93 group. We'll continue to roll that out through AEA and any of our other bargaining groups as the work evolves and develops. Lastly, we're still finalizing our opening of schools plan that we are required to submit to PDE. And I know I kind of ran through this, but I wanted to give you an update and make sure I left a significant portion of time for questions, comments, and concerns. And so that's where we are in this point. I've finished the presentation, so we're going to open up the floor, and Melissa will help to guide. Please feel free to unmute yourself and ask questions and or use the chat in our remaining time.
Stop sharing so we can see everybody. Oh, the floor is yours, attendees.
Hi, Tim Mulligan from CIS. First of all, thank you to Mr. Parker and Dr. Brown for, again, inviting us as community partners to this opportunity. I'm wondering, have you decided at what intervals you're going to make the evaluation about continuing in the virtual environment versus either the hybrid or bringing students back? Will it be on a marking period basis or some other interval of time?
So I guess at the high level, it is the marking period. However, we're being really intentional about monitoring our community status of the spread of the virus. And so while ideally we'd like to use those dates as markers, we know that those public health indicators are, I guess, a driving force as well. So if that helps.
Hi folks, Jill Pereira from United Way. First, just want to say what a tremendous amount of really quality work you all have been doing for the last couple of weeks. So thank you for leading in such a fashion. My question, and maybe this is in the weeds a bit or at a practical level, is around how community can be helpful And I'm wondering if there's videos that are already created or will be created to support families in understanding how to actually help their kids get on the platforms that you all will be using and get into virtual campus. So while the framework is out there and folks on the call understand it, kind of the next level down of how do we make sure that our families understand exactly how they have to maneuver the device to get into the platforms where kids can be in the learning mode with teachers.
Great question, Jill. We actually were having some discussion around that topic this morning. Absolutely. There are some videos that exist now specifically related to our certain platforms. So for example, there are some bilingual videos that exist to support parents with navigating Edgenuity, but we're also putting our heads together to develop some other videos, if we can, of our own on just basic level, like before you even get to Edgenuity, how to set up your space. We talked in our first update to the public about the elements of virtual learning, like routine, time, and space. So really putting some how-tos together for families to begin to build momentum and get them ready to engage in virtual learning. And we'll absolutely include you in and share those with you so that you guys can share out. Same with you, Tim, with your organization. I think that the more we can saturate our families in the community with help resources, the better off we'll be, so.
And I'll just underline what Dr. Brown just said. There's very intentional work regarding communications and family community engagement. Our FACE office. There's going to be and will continue to be some real intentionality around how we engage, educating our entire community around this approach through the communications mechanism and through our FACE mechanism that already has some roots planted, and it gives us an opportunity to really kind of ramp up what happens in that space.
One other link we wanted to share while we wait for the next question, we wanted to share links to the survey summaries. We did not share every single data point from the surveys, but we have some summaries to both the family and staff survey that we can share with you. For example, out of our approximately 2,400 staff members, we had about 1,400 complete the staffing survey. 1,081, I believe, were teachers. So you'll be able to look at some of that to shape your thoughts and give you some insights into the thinking of our staff.
I'm laughing a little bit at Owen's question. Not transportation related. Posters with QR codes to the links that they could post in the transit centers and on the buses.
That's a great idea. Melissa said she can do that. So stay tuned. We'll be in touch and share that out, but absolutely, great idea.
Owen is back in my good graces. So and all jokes aside, I think Owen, and definitely feel free to chime in here. I think transportation becomes, a really big issue, not just for schools, but probably for the entire Valley. And I think I saw Leonard here a minute ago. When you think about workforce, the implications of students not being in school and thus not being on buses, and parents also having to now address childcare, manage kids, and what that means for, transportation of all folk as well as workforce. There's implications there. And what I'd really like to hear from some of you all in this group is, some of those implications that we may not have thought of that we need to consider. As we're making the decision that's best for kids without question. But as we make this decision and begin to identify next steps, knowing what you all see as important value adds for our entire community, I think are absolutely important. So I'd love to hear you all chime in and tell us where some of the pitfalls or roadblocks may be so that we can start working towards addressing them.
It's up there.
I don't have any thoughts about that from a transportation perspective, but I'm curious about whether school space will be available for early childcare and also what would have been before and after care. And then I do think one of the other pitfalls or roadblocks is going to continue to be food distribution.
Hi, my name is Jessica. I'm from the ARC Advocacy Department. I want to thank you guys so much for allowing us to be a part of this group. To answer your question about transportation, I think one of the biggest concerns from the standpoint of people and families with children with disabilities is really how we're going to be able to handle aids or assistance on the bus, and then the cleanliness that will revolve around that. Some of our individuals are working on or having a really difficult time with mask wearing and following some of the social distancing rules. And additionally, some of those students also need one-to-one assistance. So kind of how we're going to be able to work through all of that while maintaining safety for everyone on the bus is one of those concerns.
Thank you.
Absolutely. So we're absolutely processing that, and we're thankful for some extra time to be able to process that. I don't know if our executive director of special ed has any high level information to share on how he's moving through that. He's leading sort of the development of that work for our students with IEPs.
Well, we do realize the number of students that do need one-to-one assistance with that. And as Dr. Brown said, we're grateful for the time to be able to flush that out. We have some thoughts about it, just waiting to put it down on a piece of paper before we truly understand exactly that everyone is going to be cared for.
Absolutely. And I do just want to echo, I think it was Jill who said that you guys have done a phenomenal job really taking a strategic approach to this. So I know on behalf of our community who's really worried about the health and safety of some of our medically fragile students, we really appreciate this open communication.
Thank you.
Okay, here, Nancy, trying to ask a question.
I do. I'm very happy that I'm not a superintendent right now. I'm glad to have another occupation. I was wondering, you talked about the digital divide, and do you have the data or the data on the digital divide for your school district? Do you know how many students need access to high internet or high internet capacity, or how many need hardware in order to accomplish this? Do you know how many kids you have to serve yet?
So I'll say yes and no, and then I'll tag Dr. Brown in here. So yes, in that we actually surveyed students back in April, May, when we shut down. We did the survey of students to identify students that had needs for devices as well as Wi-Fi across the city. We actually partnered with Lehigh Valley Planning Commission, thanks to Jill for making that connection, to actually map out. So not only did we have a picture of, which students, we also had a picture of which neighborhoods had the most students that did not have access to high-speed Wi-Fi. So that data exists, and that's why I'll say the yes. The no part I'll say is just that caveat that we know in 3 months' time, the financial position of lots of families may have changed. So we're leaving space in our planning for families that may have had high-speed Wi-Fi and their financial position changed, and that was the bill that got cut in the last couple of months, right? There are families that may have had high-speed Wi-Fi, but it was installed and they may have moved and they don't have it in their new home. So there are always caveats. So we do have data, but there are also going to be spaces for the caveats in our virtual registration process. we're asking every parent of every kid to register so that then they get to recertify whether they have or need a device and whether they have or need Wi-Fi. So we'll be able to cross-reference our old 3 months is old data with the new data that we're going to have to make sure that everyone's covered. So Dr. Browning, what did I miss?
I don't think you missed anything. I would just add to it that if you recall, when we spoke with you all last, we were opening up our virtual registration, not having made the decision for all students to move there. And in that regard, we were able to get an early indication, numbers-wise, of how many families who opted for that virtual learning experience were still in need of devices and Wi-Fi. So if we're looking at numbers initially, based on our early responses, about 40 to 50% of those respondents are in need of a device or Wi-Fi or both. So just to give you some numeric sort of classification, that's where we are. But again, as Mr. Parker said, we're looking to get some new numbers now, given the uncertainty of our local economic state.
Yeah, we've had parents that have reached out and specifically need support now that did not need it then. So we're being really sensitive to that variable as well.
It's going to be the whole community helping you with that. We have to.
Absolutely, looking forward to it.
We have to all chip in one way, shape, or form. So may the force be with both of you.
Thank you.
Thank you, Nancy.
You're going to need
I
a
could
force.
I could
You
just
are
pick
a
up on,
force.
Thank you.
Nancy, I was actually going to ask a similar question to that, but I'm glad you asked yours. The question I was going to say is the concern about, devices as well. And while, even if our students have the devices, I guess one of the things that I foresee happening is that they might stop working or not work correctly and need assistance. It seems to me like a pretty big concern if you have a second or third grader whose Chromebook, they can't work it anymore and needs either replacement or getting it fixed. And even if that's just 1%, that's an awful lot of devices that would need. And kids have to get these things done quickly in order to not fall behind on their schoolwork. So that was just one of my concerns. The other thing I just wanted to bring up too as a concern, and again, I know an organization like mine does address issues of social emotional needs of our students, but I foresee this is going to be a tsunami of needs, and not only in the schools that we're in, but in all the schools in the Allentown School District. And I just bring that up as a huge need that we all have to be concerned about and how to address that as they come in.
Glad you brought that up, Tim. First, the whole idea of student tech support, perhaps, I think is the best way to capture that initial scenario. We're absolutely building out a real-time viable option for tech support for our families and students. We know that will support efficacy of this virtual campus, so stay tuned for that. The second piece with regard to SEL, thank you for bringing that up. We absolutely are going to build out what those supports can look like as a part of our virtual campus. We'll be doing that through student services, and we'll absolutely be in contact with you and see what role your folks can play as we build it out and then look to implement. But that's coming next. We were focusing on instruction first and then moving into SEL. So just putting that on your radar. We just shared a link for families to confirm that each child has a device and Wi-Fi. And again, feel free to share that out with families as you all support them through your own respective agencies. But again, the goal is to have continuous feedback loops through the district and our community partners in support of our students and families. So we're right at 1 o'clock or a minute after. Are there any other questions? But thank you all. Thank you for tuning in. Thank you for your support. Just thank you again. During this time of uncertainty, we know and we empathize with our families, and we thank you for empathizing as well and helping us build out all the resources and supports that we need to help them during this time of uncertainty. So thank you, and we'll be in touch and keep you in our feedback loop. I have to stop recording from that one.
Thank you all.
Why can't I just end it?
Because I don't know how the recording works yet fully yet. It's
I don't
not.
even know.
I'll try and edit out the birthday part.
Please.
Melissa, Melissa,
Yes.
as soon as you end the meeting, it'll convert the recording for you.
Okay, and that's